This presentation will discuss the ways in which anyone can monitor and ideally prevent pressure care management issues arising. It is recommended that for everyone you provide care to, whether this is informally or formally, you should carry out an initial assessment of their needs. This allows you to identify potential risk factors for pressure care. You'll be looking at skin integrity and the pressure care risks. A very simple way to do this is using the skin principle. Look at areas such as the surface, the skin, whether someone can keep moving, whether they have incontinence needs, and their nutrition. Surface is a risk factor that we consider as part of pressure care management, but this is looking at the items that somebody may be resting upon, not the surface of their skin. We consider whether the surface is intact. Is it fit for purpose when they're sitting or lying? Is the cover smooth and intact? Creased covers can add additional pressure points. Is it inflated properly, such as air mattresses? Is it the right size, as having too small a chair can put pressure on the sides of people's bodies? Skin is the risk factor that people feel most comfortable with responding to. They have a clearer understanding that damage on the skin is represented by skin changes, so therefore can act upon it. However, by the time it appears on the skin, the person is already experiencing those issues, and often it could have been avoided. Look at the skin, look to see changes. Is it red, blistered or sore? If yes, seek advice. Is the individual able to relieve pressure by adjusting their position or by moving around? Any area that's in contact with a surface should be considered, such as heels, elbows, ears and heads on pillows. There may be a need for assistance or equipment to enable pressure relieving movements. Are they likely to spend time not moving, spending long periods in chairs or not going to bed, and therefore not changing position? Does the person have periods of time where their skin may be wet from urine or faeces? Are the pads that they wear, if applicable, appropriate for their needs, or do they need a continence assessment for greater absorbency? Have their needs deteriorated? Are they able to change their pad sufficiently throughout the day, or do they need to begin changing their pad more frequently? Is the person eating and drinking sufficiently? Do they have any dietary needs that may need to be addressed with clinicians, such as swallowing issues that have appeared? Are they experiencing changes in appetite or demonstrating avoidance around eating and drinking? Once you've completed your initial review of the risk factors, you will be provided with an understanding of someone's baseline assessment. You can then continue to review them, and this helps you to identify changes. Record and report them promptly and seek advice from healthcare and social care professionals. People's needs change frequently, but by having a greater awareness of risks, you will be able to recognise when someone may need a different response or support. Write down all the changes you have observed, however unrelated they may appear. Consider whether you have changes under the skin headings. This will highlight if you need to seek advice. Look for ways to communicate and work in multidisciplinary ways. Try to eliminate or mitigate a risk factor as far as possible. That reduces the likelihood of the pressure care needs arising at all. Reflect and learn from each incident and try to implement the learning that you've identified.